right before Thanksgiving, I started radiation and chemo. My radiation was very intense. It was 33 days every day except for the weekend to go for radiation. Meditation really was very helpful. So every day I had to go and do that. And then the effects of the radiation are kind of cumulative. So it doesn't start off so bad, and then eventually it gets to the point where it's extremely intense and the side effects are very overwhelming. I went for weekly, in addition to that, I went for weekly chemotherapy for 6 weeks. That wasn't as bad. I think it had a definitely negative toll physically as far as stamina and fatigue and, muscle loss. But they kept me pretty comfortable with medication for the chemo. But the radiation was by far very, very intense.
My treatment was very, very stressful. I first started testing in June, and it was mid-August before they finally were able to definitely tell me that I had squamous cell carcinoma. They could not get a biopsy off the tumor. They did exploratory surgery twice and couldn't get anything. They finally found the cancer cells in a lymph node doing a fine needle biopsy. And then it was races on. We know what we're up against, so we're going after it. And 36 radiation treatments and 8 chemos later, they told me, you're through. That's all we can do. So I figured then, well, the race is over. Now it's time to sit back and relax. But the race is, 23 years later, the race is still going.
He was in the hospital for 8-9 days. I was there the whole time. I slept there. He couldn't talk, he couldn't communicate, so that was very hard. They used to give him like a little board so he could write and communicate that way. But obviously, between the drugs and the surgery itself, there's not like he has a lot of energy to do that. So it was hard to be able to understand what he needs and how to make him feel more comfortable. Since I was sleeping there, this was in December, so I got him a bell, a little bell, like Christmas bell. So when he, if I would fall asleep or something, then, if he needed something, he would just move the bell, so then it would wake me up.
I was also assigned a speech and swallow therapist because the radiation burned my throat and constricted my jaw. So I couldn't open my mouth as far. So I had to go in and, do these exercises to learn how to stretch my jaw out to make sure that it didn't constrict so much that I wouldn't be able to use it like I do.
This specific diagnosis that I have is called parotid gland cancer, and it was stage 4 when after the biopsy, and this was probably in the spring of 2014. It was extensive surgery. It took over 10 hours to, get everything, that they needed to do to get me healed. And so at that point, the surgery took place by June, because we went in by spring, so by the beginning of June is when the procedure took place. And at that time, I was in the midst of having this big party for my twins. They were turning 16. And I was like, I think maybe I should cancel it because the party is in June as well. And I'll never forget the look on the doctor's face. He said, "You'll be at the party." And that kind of gave me a light.
Head and neck cancer was something that came out of the blue. I never considered myself a candidate for that. It was negative and positive, both. The negative part of it is, just going through the process, just trying to understand what it meant. And, it basically what my goals were and what my goals are now. And going through the whole recovery, the surgery, all of that is what I feel was kind of negative part of it. But the positive part of it was actually being now thinking a little bit more, and my life has a perspective now, a different perspective. Spend more time with the family. I think I have more empathy towards people and their stories, their life stories. Everybody has a life story, and just spending more time and doing things that I that I enjoy rather than working my life away.
But I really believe if there's something that I can take out of the experience that's good, it is that I feel like I'm now a better version of my former self. I feel like I have more facets. I feel like I'm more compassionate. Before thyroid cancer, I would hear from people that they were going through cancer, and I would feel terrible for them, but I didn't know how to help them. I didn't know what to say. Now I do. Now I understand that people with cancer appreciate it when you take the time to ask them what they really need.
You keep going. It hasn't been easy from the beginning, from diagnosis to all your treatments, but when you keep going, keep having that faith, and you just give of yourself, you give to others, it makes you really take life and just make it about what you really want it to be for yourself.
If anything, having oral head and neck cancer made me a better person. I'm a lot more understanding. I'm a lot more caring. I expect more from myself than what I did in the past. So I think it has made me a better person.
There was a time when I wanted to give up. I said to my radiation oncologist, I can't do this anymore. This is not sustainable. And I was ready to give up, and you have to have something to fight for. So I was fighting for my family. Really, at one point, fighting for myself wasn't enough. So I was fighting for my family. I was fighting for my daughter. So I stuck with it, thankfully, and got to the other side.
I realized while I was going through the treatment that I get one life. We all just get one life. So we better make the most of it while we're here. And because, quite frankly, my life changed in an instant when I was diagnosed with this cancer. And I try to live my life now to the fullest because I'm still here.